and we have to guard against potential transmission risks from commodities as well as inbound travelers. We need to refrain from gathering, ensure sufficient ventilation, and when we have any symptoms, we need to go to the hospital. As of November the 12th, China has administered a total of 2.3 billion doses of vaccine, and there are more than 1 billion people that have completed both doses. So today's topic is COVID-19 prevention and control in winter, and we have with us Wang Dengfeng from the Ministry of Education, and we also have with us Mr. Wu Liangyu from the National Health Commission, and Guo Yanhong from China CDC, and Mr. Lin Wei from the General Administration of Customs, and Mr. Zhang Liubo from CDC of China. And now they are ready to answer your questions. And please identify yourself before the question. Thank you. First question, please. Thank you very much. I'm with China Media Group. As you have mentioned, this wave of the epidemic has covered 25 provinces. What is the latest situation? How do you evaluate this trend of the pandemic? Wu Liangyu will answer your question. Thank you very much. At present, the epidemic in China has been stabilized. The provinces that have registered confirmed cases have now basically stabilized, and we have cut the transmission of the disease. Heihe of Heilongjiang, Shijiazhuang of Hebei, Zhengzhou of Henan, and in other places, the pandemic has been basically contained in Liaoning, Dalian, Beijing, Jiaxing, and Yunnan. The situation remains unclear, and we have to continue following the situation. And right now, the transmission in Dalian is relatively fast, and most of the cases are found in Zhuanghe Prefecture. It has not been leaked to places outside Dalian. In Beijing, the epidemic is contained in some places, and we are currently undergoing epidemiological surveys. In this wave of the pandemic, we have seen the virus transmitted to different provinces. Local governments and different levels have followed through the decisions made by the Joint Prevention and Control Mechanism of the State Council. The mechanism has also dispatched task forces to different localities, guiding the local government in swab tests and in epidemiological surveys. We are focusing on management and control of some key places in Shanxi, Neimeng, Gansu, Qinghai, Ningxia, Hubei, Hunan, Shandong, Jiangsu, Zhejiang, Guizhou, Chongqing, and other provinces. The epidemic has been well contained in an incubation period in Dalian, Heihe, Chengdu, Heihe, Shijiazhuang, Shanao, and other key cities. We have the task force currently working there, who are dispatched from the State Council. The National Health Commission will continue following the situation of COVID-19 in different localities and continue provide our guidance so as to contain the further spread of the disease. Thank you. Next question, please. Thank you very much. I'm with the Hong Kong China News Commentary. We are now entering winter. COVID-19 prevention in schools is a hot topic. and we are entering the season of influenza. And what are the measures do we have in place to protect the kids in schools? Mr. Wang will answer your question. Thank you very much for your question. We have entered winter. As you have mentioned, the epidemic has not been well contained, and winter is also the season for influenza and other respiratory diseases. So COVID-19 prevention and control is an arduous task in winter. So we have to be strict in three aspects. First, we need to be strict in checking the entrance of all the schools. Of all the measures that we have taken, we ensure that all the teachers and kids, when they enter school, they have to have their temperature taken, and they also need to show their travel history record and health code. And also on the campus, all the COVID-19 rules must be observed, and the protocols issued by the National Health Commission must be closely followed. And all the personnel must closely follow those regulations, and different rules must be put in place at all the places of the school. And also, once the school has reported a case, we need to put in place isolation measures and also keep the disease from spreading outside the campus. We also need to work out some contingency plans, and this is the requirement for each locality and each school. And when they encounter a case, they need to quickly activate this contingency or emergency plan. We have to launch the compatriot and health campaign across the country, in particular among schools. So this is a key measure to ensure safety in schools. In addition to that, we have to provide guarantees in the following areas. Number one, we need to make that all the COVID-19 policies of schools should be part of the COVID-19 framework of local government and a local jurisdiction. We need to make joint efforts between different departments, and this is the general requirements of the National Health Commission as well as the Joint Prevention and Control Mechanism. Schools are a key link of our efforts, and they need to do a good job of COVID-19 fight under the leadership of the local prevention and control mechanism. Also, we need to seek synergy between COVID-19 prevention and logistics support. Preparations must be made to quickly switch to online education in case of any confirmed cases. Also, the connection between homes and schools must be enhanced. From the current cases that we have identified, most of the cases are brought from schools to brought from homes to schools. So the COVID-19 prevention and control in school campuses is quite relevant to the overall efforts of COVID-19 in the society. So in case you have a symptom of fever or headache or cough, you need to quickly report to the authority of the school. Our measures must also cover the homes of the students and those who they live together with. Another very important effort is vaccination. Vaccination must be put into place. We encourage all the different local governments and jurisdictions and schools to quickly take the jab. If we can take all these measures in place, we will guarantee that there will be no further risks of COVID-19 transmission in schools. Thank you. Next question, please. Thank you very much. I'm with Phoenix TV. When taking public transportations, sometimes we can be exposed to the disease if we hold the handrail or touch the door or the bus, and we can hardly get sanitized immediately. So we understand that the buses provide sanitizers and also disinfectants. Will they be effective? Thank you very much for your question. Regarding your question whether we can keep our hands clean with sanitizers and disinfectant and those tissue papers, well, I can tell you with a definitive answer, yes, we can. Yes, they can. So we can keep our hands clean through a couple of means. We can wash our hands often, and we can also spray some sanitizers on our hand. And when you're washing your hands, you need to go to every part of your hand, and this includes between fingers, fingernails, palms, and the back side of your hand. So you have to be very careful. Follow the steps. Make sure that you wash your hands for 20 seconds. So we are putting in place and advocating a 6-step hand wash method. We hope that you can closely observe these steps when it is very hot, and you can roll up your sleeves, and you can also wash the other parts of your hand if you suspect that you are exposed to the disease. So that is the 7-step methodology I'm talking about. This is very complex, and when you're outside, it's literally impossible. So because there are no running water, so that is why you need to resort to sanitizers or disinfectants. You need to rub the solution on your hands. Make sure that you cover each and every inch of your skin on your hand. And these solutions, they are very lubricant, so it's quite easy for you to cover all the different parts of your hand. So it's a lot easier, and it's very convenient actually. So when you're outside, sanitizer is a best option. But make sure that the sanitizer contains alcohol, and that will ensure a very fast sanitation. But some of us are allergic to alcohol, but you can then choose other types of tissue papers. If you're outside and there is no running water, you can use those alcohol-contained tissue paper. And there are a lot of sanitizing solutions contained in those tissue paper. So when you think that your hands are dirty, and when there is no running water, you can use the sanitizer or tissue papers containing the sanitizer. All right, next question, please. I'm with China News Agency. In Heilongjiang and in Gansu, there are a couple of severe cases. And what kind of situation are they in right now? And we also heard that there are quite a few senior citizens who are confirmed cases, and there are also kids getting infected with the disease. So what differentiated policies we have for different groups of people? Ms. Guo will answer your question. Thank you very much for your question. As you have mentioned, senior citizens and those with pre-existing conditions, they are very prone to the disease. As of the end of November 12th, COVID-19 in China has reached 21 provinces. We have a lot of cases. Already, we have 300 confirmed cases that have been discharged from hospitals. Among all those confirmed cases, there are 85 severe cases, and 66 of them have been reduced to mild cases, and some have been discharged from the hospital. So this shows that we have in place very good treatment methodologies. We have guidance from experts. We have tailored treatment policies for each of the patients. So there is a lot of attention paid to Gansu. In Gansu, we had a total of 28 severe cases. But after a very effective treatment, 25 of them have been reduced to mild cases, and some have been discharged from hospital. In Inner Mongolia, we used to have 24 severe cases, and 22 of them are now in a mild symptom situation. And in Heilongjiang province, we used to have 12 severe cases. Because it happened very suddenly, and treatment has only gone through a very short period of time, and 6 of them have been reduced to mild cases, and 6 have been discharged from hospital. So right now, we still have 19 severe cases that are currently under treatment in hospital. They are in a very stable situation right now, but based on the conditions of different patients, we have in place categorized treatment, and for kids, we have a special treatment plan, and for senior citizens as well as people with pre-existing conditions, we have a different set of treatment methodologies. So all the treatment is conducted in a standardized manner. You mentioned that there are a lot of children cases in Zhengzhou of Henan province. And we used to have this kind of situation in the past, in previous waves, given the natures of children in terms of their immune system. We give them a different dose of treatment, and most of these kids, they're in a mild situation. So that is why we have dispatched pediatric doctors to provide them with professional guidance. And we also have special medical force at the local hospital to provide a very professional treatment. So all the prescriptions are customized, and we also ensure sufficient rest of those children, and we provide them also with mental support. There are kids with symptoms of fever and dry cough. And in that case, we are choosing some traditional Chinese medicine. We give them humanistic care, and this is part of the overall treatment plan. And if there are cases from the same class, and we tend to put them in the same hospital treatment room. If there are cases from one family, then they are assigned to the same hospital treatment room. Let me give you just one case. We have confirmed cases from one school, and that is between the kids and their teachers. So we assign them into one treatment room, and this is offering them a lot of mental support. But yes, indeed, there are child cases who does not have a classmate or a family member that is infected with the disease. So we are giving them sufficient care. So in general, we can tell you with great certainty that the overall treatment has been very effective for senior citizens and for those with pre-existing conditions. We have in place professional teams, dispatched to the hospital so as to give them professional guidance. So we have one treatment policy for one patient. So in general, in the treatment process, we feature interdisciplinary collaboration. And for those patients who are likely to evolve into severe cases, we put in place early intervention, make sure that our measures are effective before the condition escalates. So this is simply to make sure that the treatment can be effective. So in general, no matter it is for children, for senior citizens, or for those with pre-existing conditions, the treatment has been proven very effective, and that is why we have managed to discharge more than 60 patients from the hospitals. So in this aspect, we have truly accumulated a lot of experience. Thank you. Next question, please. Thank you very much. I'm with CGTN. Right now, China, as well as the world and our neighboring countries, are still having this COVID-19 pandemic. And there is a tremendous pressure of cutting off the disease at the border of the country. And what are the efforts made by the General Administration of Customs? Mr. Lin will answer your question. Thank you very much for your question. You have said it very well, that the COVID-19 is still ravaging countries along our border as well as the planet. The General Administration of Customs has followed through the decisions made by the Joint Prevention and Control Mechanism of the State Council. And we try our very best to put on ground those COVID-19 prevention rules and regulations. On the one hand, we are cutting off the disease from neighboring countries. We have in place warning mechanisms to closely follow the situation overseas. That is reported on a daily basis. And different ports and offices along our border, they are closely following the situation, and there are different policies and mechanisms at different localities and different offices. And when checking those inbound goods, we are also checking those incoming travelers. All the cargo that is coming inside the country, they are scrutinized. And drivers who travel cross-border and also those who live along the border, they are closely monitored. Our efforts are closely linked to the COVID-19 policies of the different localities, following the general plan of the Joint Prevention and Control Mechanism of the State Council. Along the border of China, we are following closely cold chain food and also those incoming commodities. We have sampling tests, and we also have sanitation measures. We are closely following those posts, closely linked to higher risks of transmission. And this is to make sure that all the people along the border, they can be protected from the disease, and we also ensure that vaccination program follows all such populations. On the other hand, we are giving them a lot of support, and this means our officials at the system of customs. In terms of hardware, we have in place an active pressure lab and P2 laboratory. Efforts are currently made to renovate and improve those facilities. The testing capacity of those border offices has been dramatically improved. In case of emergencies, and those laboratories. They can be of certain support to those laboratories in China's hinterland. We are also stepping up our resources at different levels along the border. This is to make sure that in a case of an emergency, we are able to quickly mobilize resources from nearby ports offices so as to cut the spread of the disease very quickly and effectively. In terms of stepping up the materials and supplies, we are channeling more budget support to border offices, and this is to guarantee that we have in place sufficient inventory of medical supplies just in case of emergency. Thank you. Next question, please. Thank you very much. I'm with Caijing magazine. So the temperature is dropping, and this will make the situation much hotter. In winter, what are the plans we have in vaccination and also in fighting infectious disease? Mr. Wu will answer your question. Thank you very much for your question. As you have said it, temperature is dropping at different localities across the country, and this is making epidemiological surveys and vaccination program much harder. According to experts, COVID-19 prevention and control this year will be more complex in comparison to last year. But we have accumulated a lot of experience in COVID-19 fight over the past 2 years. In winter and in the next spring, we are going to focus on potential risks. And we have to be early in our intervention measures. And this includes early identification, early report, and early treatment. And we need to make sure that all those key populations are put under protection. We have to be agile and flexible. Our efforts must be effective and speedy whenever we encounter any cases. So this means that we have to put in place epidemiological forces and also medical assistance teams. If we can act early, we can gain an upper hand. And also we need to focus on those small signals of the infection. We have to streamline the situation across the country, streamline our contingency measures. We request that the local government can actively and immediately report the situation whenever there is a suspected case. And also we have to be very strict. We need to strictly follow the technical specifications, put in place closed-loop management, put in place isolation measures, and also put in place sanitation measures at the borderline, and this includes the imported food through the cold chain system. We also need to step up our efforts in swab tests. Another very important aspect is to enhance the collaboration between hotels, public places, public transportation, as well as tourist attractions. All the people traveling to those places must wear a mask. If they ever show a red-colored code, the system must be activated. Also, we need to step up the efforts of checking people's health code at the community level. This is a crucial job that cannot be outsourced to any third party. While containing the spread of the disease, we have to embrace science and targeted measures. We have to very precisely identify contacts and those with secondary contact with suspected cases. our epidemiological efforts must be quickened and they must become more effective. We need to properly identify the relationships between different suspected cases and see where they cross in terms of travel history. Our goal is to achieve the best result with the minimum cost. We will try our very best to minimize the impact to social and economic development. With respect to vaccination, according to the vaccination plans, given the situation of infectious disease treatment in winter and spring, we plan to cover the vaccination program to population aging between 3 and 11. Already, we have covered more than 80 million people aging between 3 and 11. By the end of December, for people aging between 3 and 11, they will be basically completed with the vaccination program. We will integrate with other departments and mobilize our resources to reduce the risk of overlapping infectious disease with influenza and the COVID-19. We will properly designate the tasks of COVID-19 vaccination. And here I would like to remind the public to reserve the vaccination on an early basis. When you are taking the jab, put on more clothes, keep social distancing. I hope that all of you can continue supporting the vaccination program. Thank you. Next question, please. Thank you very much. I'm with the Xinhua News Agency. My question is related to vaccination on campus. Well, China has launched this vaccination program for people aged between 3 and 11. So how should schools work along with this program in terms of publicity and awareness? Thank you very much for your question. And right now, universities, colleges, and schools, they are advancing the vaccination program steadily. And right now, for people above the age of 18, the vaccination has covered more than 95% of this group of population. And as was mentioned, more than 80 million people aged between 3 and 11 have taken the jab. And the vaccination program is currently expanding to more people, and this is a very satisfactory sign. We are now talking about people between 3 and 11 and 11 and 18. So this is following the general principle of the vaccination. It must be voluntary. And we need to raise the awareness of all the parents of the kids. We also need to keep them informed about the safety and effectiveness of the vaccine and also the importance of vaccination against the disease. So number one, we need to keep them informed. And number two, all the schools, they must actively cooperate with the organizing effort and the logistic efforts in vaccination. For juveniles, when they take the vaccination, they have to be accompanied by their monitors. By monitors, I mean their parents or their close relatives or teachers. And number three, for the kids and for juveniles, and there might be some who worry about the potential side effects of vaccination. So that is why schools must provide mental support to those kids. And we see on news reports that some kids, they did cry for half a day after taking the jab. So this is a moment where schools can play an important, we can provide them with mental support so as to relieve them and reduce their anxieties. Last but not least, very importantly, we need to give more freedom to schools as well as parents. If the parents and teachers they are informed of the vaccination and they have the awareness of how important the vaccination is, but still they don't choose to take the vaccination, we would respect their freedom. So it should be conducted on a voluntary basis in a secure manner.
好，我们来请左侧区第4排靠过道第1位女记者。
Next question, please.
好，谢谢发言人。总台央视社会与法频道记者提问。
I'm with China Central Television. Fighting the disease is like fighting a war. We have seen a lot of medical doctors infected with the disease. So how should medical doctors better protect themselves? What measures has the National Health Commission taken to protect medical doctors? And we have learned that 3 medical students in Gansu province, they got infected while helping with the nucleic test program. So Guo Yanhong will answer your question. Thank you very much for your question. As you have said it, medical doctors, they're just like soldiers fighting a war against this invisible enemy. Medical doctors, they are fighting this disease. On the front line, they are routinely exposed to the danger. So they are among one of the most fragile population groups because they fight the disease on a day-to-day basis. So that is why we have to do a good job in HAI, and that is avoiding hospital-affiliated infection. This requires us to improve our system. Different medical organizations, such as hospitals and clinics, and they must improve their system to guard against HAI. Number 2, they need to make specific measures and policies, and this includes their procedures, and all the procedures that they have in place must be standardized. Number 3, we need to put in place very effective trainings because infection in hospital can be very risky. So protecting all the doctors against HAI is very important. We have to put in place trainings for those doctors and other personnel working at the hospital. And they need to make sure that they can follow those regulations and measures in their day-to-day work. And number 4, we need to enhance monitoring and supervision. We need to carefully reflect upon our practices and correctly rectify those problems identified. As you know, that the Delta variant is very transmissible with a higher viral load. Our doctors are fighting the disease on the front line, and they are highly exposed to the risks. So that is why some medical organizations, they have seen infections among doctors. And for hospitals not following regulations against HAI, and when they encounter a case, the case will be immediately publicized so that others can pick up the lesson. In fighting against HAI, our efforts should focus on designated hospitals because designated hospitals are responsible for treating confirmed cases. So designated hospitals are a key link of our efforts, and they have to invest heavily in efforts that prevent HAI, and this means that they have to improve their facilities and also their practices. So the local government, they have to select a hospital with overall comprehensive capacity. When choosing designated hospitals, and we have a whole package of standards, and we hope that the local government can carefully observe these standards when designating hospitals. Also, very importantly, anyone who works on the front line must be put into closed-loop management to ensure that we have in place health monitoring on a daily basis, and also we need to very routinely take the swab test so that we can identify a potential danger. So this is also very important. And number 3, we have to step up training for doctors before they take the post. And all the doctors must go through a training and a test before they take the post. So we attach great importance to sanitizing the medical goods that they use on a regular basis. And as you have mentioned, there are cases where medical doctors got infected while taking the swab test. And some of those cases, the medical students from a medical school. But bearing in mind, we have in place regulations, and a swab test is something very professional. It's very complex. So we hope that personnel not qualified to do the job shall not do the job. Only doctors and nurses qualified and experienced will be allowed to perform the task of nucleic acid test. And when they are doing that, they have to closely observe the regulations and specifications that we have formulated. Next question, please. Thank you very much. I'm with the Hong Kong Economic Herald. For shopping malls, cinemas, and theaters, what measures should we put in place in terms of sanitation? Mr. Zhang will answer your question. Thank you for your question. This is a very good one, and this is about the sanitation of indoor places. I believe you are not just talking about sanitation, and you actually are asking a comprehensive set of measures. Now, there's a lot of attention paid to this issue already because shopping malls and supermarkets, and they are closely linked to our day-to-day life. So they have to be open to the public. While remaining open to the public, measures must be put into place against COVID-19. And we as shoppers and consumers, we need to go to those places, but when we go, we have to shorten the time span that we stay inside those indoor facilities. And we are buying commodities there. We're not wandering about in those indoor places. For cinemas and theaters and supermarkets, for those indoor places, and there might be 7 problems that we have to pay close attention to. Number 1, sanitation. Sanitation must cover all the key facilities, all the key places. For example, shopping carts, shopping baskets. So they have to be sanitized each time after use. They have to be disinfected after each cycle of use. For example, reception desk, elevators, shopping carts, sanitation must be put into place. And also sanitation should also cover the corners of the building, and this includes the wall surfaces. Number 2, the risk exists in air conditioning system. Well, we have different types of air conditioning systems at different places. Some air conditioners, they support ventilation. We need to put in place very careful sanitation measures for those air conditioners.
这些地方因为那个位置比较这个场地比较
So air conditioners are oftentimes installed at a covered place, and some of those places are not easily accessible.
这个时候可以
So this is
最大
the
的
time
量来运行
where we
当然
can
这一种用区
max out
用
the
最大新风量运行的
operational
应该只是一
specs
个
of
过
the
渡的
air
阶段
conditioners,
尽早的
but this is only a
全修
contingency
或者是
measure,
对回风
and
进
we
行
hope
消
that
毒以后
we
再来
can
运行这是第二个是集中空调的
and we hope
这个
that
管理
we
问题
can adapt to those ventilation supported air conditioning
这
system.
些
And number 3,
应该是
the serving staff
接种
at
疫
those
苗
indoor
应该
places,
是
and they must
健康的
take the
申报
vaccine.
有体温
There
检测
must
制
be a health
及时发现
monitoring system,
症状
and their
第四
temperatures
个
must be
是我们对顾
taken
客
on a regular
应该进
basis.
行健康扫码登
Number
记
4,
应这样呢
all
便于
the
追溯
consumers
应该
coming
建立
inside those
体温监
places
测制
must have
尽
their
早地
temperatures
识别
taken,
可疑的
their health code must be
我
checked,
们在购物的时候
and
应
we
该
need to
保
make
持
sure
距离这
that
个1米远至少应该是1米远
social distancing is closely
在
observed,
这些
and
健保
this
发
is
生你过秤的时候交款
to
的
say
时候
that they have to keep a distance of at least 1.5 meters, and this is
第五
a
个
very
我们在
important
付
rule
款的时候
that you need to
应该
follow
是
when you
尽量
are
地选用这种
checking
非
out.
结租的方式用
And number
用这种
5,
非结租的
in the
电
link
子
of
付
payment,
是最好的
we support and we encourage
不管是顾客
contactless
还是
payment
我们
method,
那个工作人员
and this is
都应该
basically
戴好口罩，都应该
electronic
戴好
payment
口罩，
method.
做好防护
Number 6,
同时呢
mask
要做好
wearing
手卫生
and personal protection, and this means that all the people must wear a mask, wash your hands
也
often,
是最后一个问题要做特
and
别注
keep
意
social
如
distancing.
果
And
是
number
你
7,
发现
very important,
可疑的这个病
if
人
you have
发现了这些
identified
密切
a
接触者
suspected case,
应该及
or
时
if you have
跟向
if you have identified a close contact, you need to
来配合
immediately report to the local
防控工作。
CDC.
在他们的指导
Also, you need
下
to cooperate with the efforts of the local CDC and work together with them for epidemiological survey as well as
好，我
sanitation
来请座
measures.
席第3排
Thank
第
you.
2位男记者。
谢谢南方都市报记者，请问一下，在这次
I'm
的
with
新冠肺炎病例中，中医药发挥了什么样的作用？
South
然后中医
China
在中医
a
药
newspaper.
协同治疗方面有哪些的安排？
So, what role has traditional Chinese medicine played
郭艳红女士
in
来回答这个问题。
treating this wave of
谢谢
COVID-19?
提问啊，其实在
Ms. Guo will answer your
这次我
question.
们新冠
Thank you very much
患者的救治
for your
工作当中
question.
啊，应该说呢，这个中医
In the
药
recent
发挥了
wave of
非常重要的作用
coronavirus pandemic,
在这个过程当中呢
TCM
我们
has
的
played
专
a
家
very
也是
effective
边
role,
救治哈边总结
or
筛
TCM
选出了
experts,
一
the
批有
treating
效的方
patients,
药啊，
the
既有呢
accumulating
通过
their
也有呢
experience,
针对
they
不同
have
病情啊不同症
uh,
状的一
selected
些方剂
a
同时呢
package
还有
of
中
very
药
effective
而且
solutions
在治疗的过
and
程当中呢
prescriptions,
体现
and
了
we also
便
have
利辩
combined
证的统一
Chinese
一
and
个
Western
呢就是对
medicine.
于轻症和
We
不
follow
轻
a
症的患者
scientific
可以
approach
说在用
in
药
selecting
方面
medicines.
是
For
以呢
example, if
中
the
医药的
patient
这个
is
治疗为主，
mild
特别是
and
呢在改善患者的像这个发
uh,
热啊、
a
咳
mild
嗽、
case,
纳颤、
we can
乏
use
力等
some
这些
traditional
临床的
Chinese
症状
medicines.
当
And
中呢
if the
可以说发挥了
patient
很
is
好的作用。
showcasing
在这个过程
coughing
当中呢，
and
应该说
low
中西医
fever,
之间
then
是结合
TCM
的
can
比如
play
说
a
像
very
西医方
effective
面
role.
更多地给予患者
But in
啊
general,
一
in the
些呢
treatment
这
process,
个
we feature
这
integration
个
of Chinese medicine and
养
Western
疗
medicine.
啊对症支持
We give
减
them
少呢
oxygen
这个
treatment.
轻
We
症
put in
啊
place
风险
customized
相对应的
treatment.
转化。那么对于呢这
So
个
those
重症的
measures
患
have
者来讲呢，
proven to
这
be
个中
very
医呢
effective
是也是
in
发挥了很好的作用，跟中西结
preventing
合在
the
一
disease
起。那
from
么通过呢
evolving
这
into
个
severe
使用
cases.
一些这个中医药
TCM is
啊
now
在一些
used
高
in
热
association
高
with
热
Western
包括呢
medicine,
促
and
进
this
呢
has
这个
proven very
肺部
effective
渗出的
in
吸收
treating high fever
也能够起到一个非
and
常好的
also
作用。
in
第三个这个
improving
对于
the
康复的患者
pulmonary
我们
absorption
对于呢康复的患者，往往就是
for
一个呢
medicines.
就是肺部的这个
And also
渗
for
出
patients
有明显的改变
discharged from hospital,
这个发热的症状、咳嗽
TCM has
以及2次
turned out to be very effective.
基本上这些患者就可以治愈出院。
We
而
have
呢往往这些患者啊，他还是
seen
有
that
一些
those medicines are very effective because
像乏力呀、
after
纳
taking the
颤呀、
TCM
气虚
medicine,
呀等 在这些方面来讲呢，
Some
这个
patients
疫苗
can
在
show
这些
inactive
患者的
results
康
even
复这
after
方面
2 times of
可以呢
swab
发挥
tests.
非常好的这样一些作
So
用。
this means that the
此外，这个
TCM
针对呢
plays
像
a
一些
very
重症的
important
感染者，
role
还有包括
in
呢一些呢
helping
这
those
个在隔离
patients
点的
recover.
一些集中隔
And
离
also
的这些
there are
密接和
patients
亲密接
without
人
any
员，
symptoms.
也是呢这个
In those
指导
cases,
个体
TCM
根据
is
呢
also very
这个
effective.
当地的气候和人员的这个
There
自
are
身
a
的
lot
这
of
样一个体
people
质的不
with
同，来
close
呢进行
contact
了
or
一些呢
secondary
重要
contact
的一
with
些呢
suspected
预
or
防的治
confirmed
疗。
cases.
所以说呢，
And
大
we
家可以
advise
看
that
到，就
these
是
people
从
can take some
我们
Chinese
的预
medicine,
防
and
一直到轻症的治疗，
reality has
重
shown
症
that
的
this
治疗
has
康复整个全
proven
过
very
程，
effective.
实际上中西医
Throughout
都是
the different
中西医
processes
这
of
个结合
identifying the disease,
这个中
diagnosing
西
and
药并
treating
用。
the
而
disease,
在这个过程当
and
中呢，
recovering
但是我
from
们
the
建立了一
disease,
个私有的
TCM
机
has
制。
been very
这个私有
effective.
的机制呢，就是在定点医院当中这个我们
So
第一要
in
有
designated
非常
hospitals,
有中医的团
we
队，
need to
第
have
二
a
呢要有
TCM
机制，
team.
也就是中西医这样的一
We
个
need
这
to
个
have
协
a
同的机制。
mechanism. We
第
already
三
have
呢
a
要有措施，
mechanism
第四呢就是
using
有
TCM,
成
and
效。
there are
而在
TCM
这个
related
过程当中，我们
measures,
还建立了4
and
个
of
联
course,
合。这个
the
4个联
result
合
has
就是
been
第一呢，
very
就是
satisfactory,
这个
and
中
there
西
are
医我
also
们是联
for
合组成的
association,
国
for
家级的
example, the
那么
association
第二呢，就是
of
呢，这个
TCM and
在
Western
呢这
medicine
个
in China's national
制定和
health
完善
teams.
诊疗方案当中，
And number
中西医
two,
的专家
in
呢
the
也是联合
treatment
在一起
package,
对诊疗方案
TCM
呢进行
doctors
不断
and
的完善
Western
和
doctors
修订。
work closely
第三呢
together.
就是什么呢？联合
And number
呢
three,
这个
the
对我们
association
这个一
between
线的这个
TCM and
工作
Western
呢
doctors
进行指导会诊。那么刚才
in
虽然
terms of
李良也提到
professional
疫情
treatment
只
support
要
to
一
those
发生的时
fighting
候
on the
那么我
front
们
line.
都呢
As
派
was
出了多个
mentioned,
队
that
伍，
each time
其
when
中
there
的
is
一
the
个重要的
case
队伍就是医疗
identified,
救治
we
队伍。
dispatch a lot
而
of
医疗
teams,
救治
and
队
one
伍
of the
的
team
国
is
家级
of
的
course
专家
called
在派出的过程
medical
当中
assistant
也
team.
是呢
So
既
when
有
we are dispatching
这
such
个
a
西医
team,
当中的
the
像
team
重症
consists
呼吸
of
感染
Western
也有呢我们
medicine
中医的专家
doctors
那么联合
treating
赴一线对呢
severe
这个
cases
一线的救
and
治工作呢进行联合
infections.
的指导
But in that team, we also
那么
have
另外
traditional
呢第
Chinese
4个联合呢
medical
就是呢
doctors.
在救治
Another
过程当中的
association
一线的团队
is
也专门呢有中医的这个
those
医务人员
frontline medical
中西结合在
doctors.
一起
We
共
have
同呢为患者呢提供
Chinese
救治
doctors
所以在这个整
using
个的
traditional
患者
Chinese
救治过程
medicine
当中
as
的
well as
全程
doctors
应该说
using
呢都
Western
是
medicine.
体现了中
So
西医
throughout the
结
whole
合
process
中西药
of the
并重的
COVID-19
这样一个原
efforts,
则可
we
以说呢
feature
整体的效果呢
and we
也
insist
是非
that
常不错
traditional
的，而且
Chinese
在这方
medicine
面来讲
should be
我们
integrated
都
with
不
Western
断地
medicine.
积累了
And
一
the
些呢
result
非
has
常
been
好的
very
经验
satisfactory,
应
and
该
we
说
have
不光是
accumulated
在
a lot of
新
very
冠肺炎
meaningful
病当中，
experience,
其实在其他疾病的救治
not
当中
just
中西医结合
in
也是
terms
非
of
常重要
COVID-19, but also in other diseases.
好，谢谢，
COVID-19,
请继续提问。
Western medicine
好，我们来请
and Chinese
左侧区
medicine are used
第二排第
together,
三位穿白色
and
衣
it
服
has
的提问
been proven very effective. Next question, please.
谢谢主持人，我是中国教育电视台
Thank
记
you
者。
very much.
我
I'm
们
with
注意
China
到本轮
Education
疫情
TV.
在北京、郑州
We have
等地报告
noted
的这个
that
病
in
例当
Beijing
中
and
都
in
有中小
Zhengzhou,
学生，所以想请问教育
some
部
of the
门会
cases
采取
reported,
哪些
there
防
are
控措施，
students
如何
from
避
middle
免
school and
疫情
primary
在校
school.
园内的传播呢？
So what measures
好，我
do
们
we
请王
have
登峰
at
先生来
the
回答。
Ministry
好，
of
感谢记
Health?
者的提问。那么对于
Thank you very
中小
much
学出
for
现
your
新冠
question.
肺炎
For
疫情，这首先
primary and
就
middle
是要
school,
启动新冠肺炎疫
yes,
情
there are
防
some
控
cases
应急
reported.
那么
To
这
do
是
a
我
better
们
job,
在对所有的染疫
whenever
学校
they
基本
encounter
要求，也
a
是各地各校
emergency,
其实都
they
已经
have
有
to
了充分
quickly
的准备。
activate
我们说
their
宁可
emergency
备
plans.
而不
And
用，
we have been
但
doing a lot
这
of
个用是
preparations,
可
and
以
we have been
那
seeing
么这个
that
应急
we
院呢，其实
cannot
最主要的
afford
首先就是要
not
做好
having
对染
a
疫的师生
preparation or
要进
contingency
行
plan.
救治
So whenever we have an emergency, we have to
在这
immediately
同时还要
put
启
the
动
infected
相关
teacher
的
and
一些这个
students
私密这些
in
这个隔离
under protection
那么
and
这些呢
into
都要
designated hospitals, and also they need to be immediately isolated. And when we do so, we are closely following those COVID-19 prevention measures. And also we must make plans to shift all teaching activities online. Because sometimes when there is a severe case or a case reported, school activities cannot be continued and teaching activities must be shifted online, and students can learn at their homes. And during isolation period, what about the PE class? We have to make sure that online courses should also cover those subjects, so that the kids can do some workouts and exercises, even attending the courses online from their homes. So this is about the schools that have been involved in the infection already. So how do we keep off the disease? I have actually touched upon this issue earlier. We have in place 3 stricts. We keep off the disease very strictly, and this means that at the entrance of the school, there must be temperature check, health monitoring. Inside the campus, we have to closely observe all the COVID-19 rules. And number 3, if the school has reported the case already, we have to put in place isolation, put those cases quickly into designated hospitals, and shift our teaching activities online. So we have to make sure that when the school has reported the case, the school does not turn into a source of further spread. So this is crucially important, and you have learned from news a couple of days ago that one of the close contacts was from school. And when the school learned the situation, the school immediately made a decision that all the students must be staying inside the school for a swab test, and they shall not be discharged unless their swab test shows inactive results. So this is very important. So we have to cut off the spread of the disease on the campus, and also make sure that the school does not further spread the disease out to a larger area. So this is very important. So these are the measures that we have in place for our schools, and these other schools, they must also closely observe those regulations.
好，我们来请
Next
右
question,
侧区
please.
第3排第3位穿白色衣服的记者。
谢谢主持人。人民日报
Thank
记
you
者
very
提问
much. I'm
现在
with
快递已
People's
经成为
Daily.
我们日常生活中不可缺少的一部分了。
Mail
尤其是
packages
超
has
市
already
刚
become
过
one
正式
part of
中收
our
到
life,
快递的
and we
时候
have just
那么很多人会
seen
关
the
注
shopping spree festival in China. A lot of us taking packages from delivery services, and what is the risk of
张六波先
exposure,
生来回答这个问题。
and what are the measures that we have against such risk?
快递现
So
在
Mr. Zhang will answer your
比较关
question.
注 关于
Thank you
这
very
个
much
快递
for your
传播
question.
新冠肺炎
A lot of
我
us
想的话
are very
应该
concerned about
同
the
时满足
exposing
这么几个条件。
risk
第一个
from
条件
mailing
应该是
packages.
快递
For the
在收的
package
时候
to
或者是
be
在
able
运
to
的时候
transmit the disease, and there must be 3 conditions.
这是
Number
第
1,
一个有它被污染。
the package is infected in the first place
到我们手上的时
in the
候
mailing process.
这个上
Number
面的病
2,
毒还活着。
when the mailing package arrives at your doorsteps
因为气
or
温低
on
了
your hand,
干燥了
the virus is still
我
alive.
们要注
Well,
意。
this is winter.
当然，第三个是
The
我们
weather is very dry, and this is very conducive for the survival of the virus on the surface of packages. The third condition is that
这些东西
the hand
所以
gets
我
infected
们如果是黄，也
while
就是
picking up the
这三个方面。
mailing package.
第一个，
So
对于这
to
些
do a good job, we have
第一
to
个
closely
对于我们这个
guard
快递
ourselves against those 3 key links. Number 1,
那么我们
how
就要
should we
求
protect the
第一
packages
在
from
这
being
种高
infected
风
in the
险
mailing
地区
process?
那就要停
And
止
this means that
这个快递
in the high-risk area, medium
这个
risk area,
发额
the mailing
这些
service
高
must
危
be
风险
suspended,
人群就应该
because those high-risk area is the place where there are people with confirmed cases, confirmed symptoms.
那么我们快递员自己
So this is very important, and those delivery service personnel, they must step up their health monitoring
污染这
to
个
make sure that they do not get infected, and when they get infected, don't even touch the package
那么
and don't go to work
我们
when you
要
are infected,
在快
and
递的
this
这
is
种转运的过程
very
还
important.
要做好
And
保
also
护
while transferring
包括
those
这个
mailing
包装不能够
packages,
直接地暴露
protection must be put in place. For example, the packets cannot be exposed directly to the ulterior environment.
以及在这种分拣集中
Also, very importantly, when they are sorting those packages,
进行消毒，
they need to put in place sanitation measures.
喷雾也行。
And normally, we need to spray some disinfectants, and we can also
把这个
use the X-ray to
污染
disinfect
给杀死。这是
those
第三条
packages.
是我们在
Number 3,
在
very
收
important,
快递的时候
when
要做好至少
ordinary people like you and me, when we are picking up the
除了戴口
mailing
罩
package, we have to protect ourselves. And this means we need
除
to
了做好手卫生，
wear a pair of
这个
gloves,
包这个快递的包装
put on a mask,
不带到家里面去，在外面才
and refrain from
少一道
taking the package
如
of
果你一定
the
要带回
box
去，那
to
么
your home.
你在那个
If you
不
have
清
to
楚
do
这个
this,
究竟干不干净的
you
情
need
况下
to
你就可以
disinfect
用这
the
个消毒纸
package bag,
对它的釉面
or you can rub the surface using a
在最后
disinfectant
也可
tissue.
以直接用消毒剂在它的表面
And also, you can spray some
这样的话呢
sanitizers.
我们可能
So
就能够比较
if we
好地
could do all this, we can very effectively guard against the risk of infection by mailing packages.
快递的处理以后
Also, I have to say that after
因为手接触它
doing all this, we have to wash our hands often because the hand
谢谢。
is
时间关系，
a
我们最后
medium
提两
of
请继续提问。
infecting the disease.
好，我们先请
Last
这个
two question,
第三排
please.
最靠边这位男记者。
好，谢谢主持人。红星新闻记者提问。
And with Red Star News,
机制医疗救治组
earlier,
发了
the Joint
关于
Prevention
进一
and
步
Control
强化当前
Mechanism of
新
the
冠
State
病毒核酸
Council
检测服务的通知。各地
circulated
要在
a
近期内对
notice
核酸检测
on
工作各项要求
improving the
实行
effort
在部署
against
再检查
COVID-19 in
如今
winter,
通知已经发布了
and
半
different
个多月了
localities
请问针对
are
通知中
following
提到的各项
through
要求
this
各地的
notice,
核
and
酸
the
检
notice
测
has
机
been
构
there
落
for
实
half a
情况
month.
如何另外
So
当前
how is the
各地
notice
也出现了
implemented?
散发的疫情那么请问现在各地的核酸
Already
检测
there
的
are
是否
sporadic
成
cases
熟
in
能
different
否满足
places,
应
and
检尽检
does
和
the
愿
different
检尽检
localities
人群的要求
have
谢谢
the capacity
好，我们
in
请郭艳茹律师
exercising
来回答
swab
这个问题。
tests?
好，谢谢
Madam
这位
Guo
记
will
者的
answer
提
your
问
question.
应该说呢，核酸
Thank you
检
very
测
much
呢是
for your
我们
question.
落实
Swab
的
test
四扫
or
的
nucleic
一个
acid
关
test
键的措
is
施。
crucial
10月22
for
号
us
呢
to
这个
identify the
国务委员会
infection
联合国际
early.
医疗救治组专门对全国有关
On
加
November
强核
20th,
酸检测服务
the
这
Joint
项
Prevention and
工作
Control
呢进行了
Mechanism
再部署、再要求。
convened
应该
a
说，这
meeting
个从文件发布以后到现在，
improving the efforts of swab
应该说
test.
大量工作。
Since
在
the
这个
notice
有
has
关
been
的
announced,
建设这个
a lot of efforts have been made at different localities. We are making reasonable plans, improving our
首先
service,
呢，就是
taking multiple measures.
这个加
Number
强
one,
了这个核酸检测机构的
we
这样
have
一个合理
improved
化的布
the
局，进行了网格化的管
capacity
理
of
让老百姓呢
nucleic
能够呢
acid
就近哈
testing
就能够
organizations,
这
and
个
they have been
这
properly
个寻求到
arranged
核
from
酸
a
检测服务
geological
而在这个过程当中呢，
perspective
各
so
地呢
that
也纷纷呢
people
以
can
各种
have
形式
convenient
在社会
access
公开
to their
有的呢
services.
是在网站上公开了这些
And
机
the
构的
information
名
of the
称、
location
地
of
址、
those
服务时
organizations
间
are
这
well
个向
publicized
公众们这个
through
告知
multiple means,
另
for
外呢，
example,
有的呢还
online
用了我
and on
们
different
电子导航
platforms.
的技术或者是地
And
理
some
图
of
的这样一
them
个技术
are putting in
能够
place
呢让老百
electronic
姓呢能
maps
够了解啊
so
这
as
些
to
核酸检测的
make
机构
the
能够呢
location
就近啊
of these
这个
organizations
得到
known
呢
to the
这个
public.
核酸检测的服务。第二呢，就是呢优化了核酸
Secondly,
检测的
we
这些
have
服务，比如
improved
说像
the service
很多机
of
构都
swab
开展了
tests.
线上的预约
For
服务
example,
同时呢，
some
这个
organizations
延
have
长
in
了
place online
检测的时
preservation,
间啊
online
拉长了
reservation
班次
services,
那么有的呢
and they
还
have
这个增
extended
加了
their working
这
hours,
个
added
检测的号
shifts to
源
their
来能满足
staffing.
老百姓应检尽检、愿检尽检的要求。
So they have
特别是呢
dramatically improved their
这个
capacity
很多机
simply
构
simply to
都
meet the
开展
needs
了24
of the
小时
general
的
public.
检测服务，
Some
能够最大
organizations
化地
are
来
running
满足这个
24/7
人民群
so
众
as
核
to
酸检测的这样一项需求。
maximize their
第三
provision
呢
of
就是呢
services to
这
the
个
general public.
大
And
大
number
地
three,
缩短了结果
they
的
have
这个时间。
greatly
那么对于呢
shortened
重点人
the
群啊，我们已经
period
实
of
现了
time that you have
46
to
小
wait
时以内
till you
对
get the
重点人
result.
群的核酸检测结果
And for
来进
key
行及时的
publishing
反馈。
groups, the
那么
request
对于呢
or the
愿
requirement
检
is
愿
within
尽
6
检
hours.
的这个人群
For
部分地
hospital
区呢也已经实现
affiliated
了
swab tests. In some places, the result can be published within 6 hours. Some places, they are leveraging some online platforms so that the result can be pushed to you directly on your cell phone, or you can quickly check the results on your health code, and you can easily get it printed out. And number 4, improving the quality of nucleic acid test. So swab test is something quite technical. So while ensuring quality, each and every swab testing organization, they have to improve quality control at the indoor facilities, and also the supervisors and regulators at the provincial and municipal level and at the national level are regularly conducting inspections at those places. Since the beginning of this year and up until present, we have conducted 9 rounds of such inspections. And we also offer quick feedbacks to those testing organizations at different levels. And those regular inspections has been intensified, and we know that in case of epidemic, a lot of the local jurisdictions put in place a population-wide swab test campaign. And this is simply to ensure that each and every one of us can be protected. We have a standard that if a city has a population of 5 million people, it must be able to complete a population-wide swab test within 2 days. If the population size of a city is larger than 5 million, then within 3 days, it must be able to complete a population-wide swab test. And this is very important. And so you need to closely follow the standard, and based on this standard, you need to make some careful plans. But once the population-wide swab test campaign is activated, there will be some weak links. Some of the jurisdictions are lagging behind, and if such case occurs, then resources can be mobilized from the provincial level. If there are still some difficulties, then at the central government level, resource will be channeled to that particular region or jurisdiction to supplement its capacity. Also, information support is crucial. We are now working together with relevant departments so as to scrutinize different information systems. We are currently undergoing an assessment process for all the information systems, and this is to guarantee that sampling, testing, and transferring of samples, and also result publishing. So through information technology, we can improve efficiency, and also we can improve the whole process coordination of the efforts. Thank you.
好，谢谢。最后一个问题，
Last question, please.
请右侧区第4排第2位穿绿色衣服的女记者。
中国青年报记者提问。目前疫
I'm
情发
with
生区域
China
下进
Youth
行课
Daily.
是否会考虑像
Now,
2020年
in
春季学
places
期一样
where
全面
there
开
are
展线上
confirmed
教学？
cases,
受目前疫情影
schools
响，很
are
多家长会
suspended.
讨论，
Will we
就
go
今
back
年
to
学生
online
的
teaching
大
just
部分
like we
会
did
线
in
上
spring
放
last
线
year?
上放假吗？
Will it be likely that college students are discharged from school earlier for a winter holiday? Thank you for your question. For schools in those high-risk areas or cities, some of the primary schools and middle schools are suspending their activities, and some of the universities, they are currently practicing closed-loop management. So, under such circumstances, it's crucial that we switch to online education, but this is not necessary for all the schools out there across the country. I'm only referring to those schools and universities located in cities already with a lot of cases according to the COVID-19 rules. And over the past 2 years, we have accumulated a lot of experience, and we know when to suspend schooling activities. and we know when to shift to online teaching. So we have a lot of experience in this regard. So only when it is necessary, we will go online. Whenever it is necessary, we can quickly switch to online teaching. So after 2 years of hard efforts, much experience has been accumulated. We've made a lot of preparations in terms of online courses. Online courses are not just those liberal arts subjects, but also mental courses as well as physical education. So this is simply responding to your first part of the question. And now we are entering winter, and some of the schools out there, they are already planning their winter holiday. We request that different localities can make careful decisions in light of the epidemic situation of their city and also the general decision made by the Joint Prevention and Control Mechanism of the State Council. And we have to follow this pace. Already some of the schools, they are making some early plans, in particular in northern part of the country. It's very cold in winter. Winter holiday is likely very long. But you need to follow one general principle when you decide whether to discharge the students early. Number one, look at the situation of the epidemic and also take into account the regulations of the local government in terms of COVID-19 fight. And also, if you discharge the students early for winter holiday, you have to understand that the students, they are traveling between cities. Take into account where the students are from and where they are going when school is closed. Also, very importantly, we need to take into consideration the actual realities of different schools and different cities, and bearing in mind that a school is located in a place and the COVID-19 situation of that city must be taken into consideration when you are making a decision of having the winter holiday earlier. Also, you need to look at the overall pace and progress of the teaching activity. I hope that we can all pay attention to COVID-19 fight in China. If it's truly necessary, that you discharge the students early from school, and we should be understanding. Thank you very much to all the presenters and to all the representatives from different departments of the authority. And thank you for introducing us vaccination, swab test, as well as COVID-19 prevention rules in schools. Thank you again to our distinguished guests, and we will continue hosting more pressers. So this is the end of today's release. Thank you very much.